Good morning, good afternoon, good evening, and a very warm welcome to this regular COVID-19 press briefing from the WHO Regional Office for Europe here in Copenhagen. We welcome you all today. I'm looking forward to the journalist questions from the journalists that are joining us online. As always, we've received questions from those of you that are joining us also in advance, which I'll come to shortly. Joining us today, I have the Regional Director, Dr. Hans Kluge, sat to my left here. We're also joined by Dr. Catherine Smallwood, the COVID-19 Incident Manager here at the WHO Regional Office for Europe, and also Dr. Siddhartha Sankar-Datta, who is our Regional Advisor on Vaccine Preventable Diseases and Immunization. So a very warm welcome again to you all. Before I come to the questions, of course, I'm going to hand the floor to our Regional Director to say a few opening words.
Good morning, good afternoon. Last week marked 1 year since WHO announced that the public health emergency of international concern declared on 30 January 2020 represented the first ever pandemic caused by coronavirus. Since then, we've seen nearly 42 million cases in this region alone, and more than 120 million globally. But we've also seen giant scientific leaps and the introduction of effective tools that give us power over the virus when used effectively. The power of the collective, the heroism of our frontline. When I look back at the past year, I see remarkable attributes we have all expressed to limit the spread of the coronavirus. Ultimately, our behavior is saving lives. The danger, however, is still clear and present. The current situation is most acute in parts of the region that were successful in controlling the disease in the first 6 months of 2020. It is in Central Europe, the Balkans and the Baltic states where case incidents, hospitalizations and deaths are now among the highest in the world. Case incidence continues its increasing trend and is moving eastwards. We have now seen 3 consecutive weeks of growth in COVID-19 cases, with over 1.2 million new cases reported last week across the pan-European region. Last week, new deaths in the region surpassed 900,000. Every week, more than 20,000 people across the region lose their lives to the virus. The number of people dying from COVID-19 in Europe is higher now than it was this time last year, reflecting the widespread hold this virus has. We are yet to see the widespread health impact and benefits of vaccines, which I can assure you will come. But for now, we need to remain steadfast in our application of the full range of tools to respond. Some 48 out of 53 European countries or territories have reported the B.1.1.7 variant of concern, which is gradually becoming predominant in our region. And yet, in the context of this faster spreading variant, several countries, including but not limited to Denmark, Ireland, Portugal, Spain and the United Kingdom, have rapidly reduced transmission with public health and social measures to levels that can and must be kept low. 5 countries in the region have received vaccines from the COVAX facility. Fair and equitable access to vaccine, the overarching concept of COVAX, is happening in reality. The gap in access to vaccine in our region is narrowing, yet inequity persists, with all high-income countries having rolled out vaccination, yet only 60% of middle and lower-income countries having done so. As of today, a total of 46 countries in the region have administered more than 107 million doses of vaccine. 3% of the population in 45 countries have received a completed vaccination series, and data from 23 countries indicates that 51% of health workers have received at least one dose. While 27 countries are currently in a partial or full nationwide lockdown, 21 are gradually easing restrictive measures. Some are doing so based on the assumption that increasing vaccination uptake in countries would immediately lead to an improved epidemiological situation. Such assumptions are too early to make. Let there be no doubt about it. Vaccination by itself, particularly given the varied uptake in countries, does not replace public health and social measures. With vaccination coverage in the region ranging from less than 1% to 44%, it is also far too early to demonstrate the effect of vaccines on overall COVID-19 hospitalization and deaths. Nonetheless, early data from Israel, Scotland and the UK linked to effectiveness against severe disease by the Pfizer-BioNTech and AstraZeneca vaccines is promising and show lives are being saved. As vaccine uptake increases, their broader impact will become visible, and studies like these will guide policy and improve our understanding of how the different vaccines contribute to our response. We welcome these studies, stressing that the available data is limited and that further research is urgently needed. The WHO Regional Office for Europe and the European Centre for Disease Prevention and Control have developed a robust protocol to study vaccine effectiveness in community settings to allow effective comparison of the results between countries. A number of countries in the region have temporarily suspended use of AstraZeneca vaccine as a precautionary measure based on reports from few countries of rare blood coagulation disorders in persons who had received the vaccine. The detection, investigation and assessment of these cases is a testimony to strong surveillance and regulatory mechanisms. In vaccination campaigns, it is routine to signal potential adverse events. This does not necessarily mean that the events are linked to the vaccination. Venous thromboembolism is the third most common cardiovascular disease in the world. It happens in populations regardless of whether they are vaccinated or not. COVID-19 vaccination will not reduce illness or deaths from other causes. As of now, we do not know whether some or all of the conditions have been caused by the vaccine or by other coincidental factors. WHO is assessing the latest safety data, and once completed, the findings will be made public. At this point in time, however, the benefits of the AstraZeneca vaccine far outweigh its risk, and its use should continue to save lives. Vaccines work and will eventually allow a return to a new normal. But for that to happen, we need to rely on science and have confidence in the incredible protection afforded by vaccines against all vaccine-preventable diseases, including COVID-19. Meanwhile, we keep one eye fixed on the future. This week, the Pan-European Commission on Health and Sustainable Development, chaired by Professor Mario Monti, former Prime Minister of Italy, issued a call to action to rethink policy priorities in the light of pandemics, to fix the fractures and address the conditions that allowed COVID-19 to happen. This is a concrete step towards making health a centerpiece of society, preparing for future health emergencies and making sure that the notion of health as peripheral is a thing of the past. Stay safe. Thank you.
Thank you very much, Regional Director. Right, let me come to the questions for our panel today. I'm going to go to, first of all, thank you for joining us again. Please raise your hand in the Zoom function. As you'll be aware, colleagues, we have also the chat function open today so that you can reach me via that forum there. I'm going to go first to Adam Blazej, and it's a question related to the temporary suspensions of AstraZeneca vaccine, which the regional director just referred, and it's a question for Siddhartha Datta. What indicators did you follow when assessing the possible health risks of the AstraZeneca vaccines? Do you take other than strictly medical criteria into account? That's the first question, Siddhartha. I have a second also from Adam, who is from the Czech news agency CTK. Siddhartha Datta, please.
Thank you, Rob, and I hope you hear me well. So yes, during the process of evaluation of any vaccine product, we consider a couple of elements. First is the results of the safety of a vaccine, including the efficacy of that vaccine that we gather from the different phases of the clinical trial, phase 1, phase 2, and phase 3. Including these safety and efficacy data of the vaccines, not only for AstraZeneca, it's for any vaccines which are being evaluated by WHO. We also look into the good manufacturing practices of the manufacturing nodes of these vaccine developers, plus the sustainability of a product and its usefulness within the distribution to the middle income and the lower income countries. These factors are extremely important so that we can cater to the vaccine use in this country when WHO would issue the emergency use listing. During this process, we also look into the common side effects and the rare side effects of the data that has come from the clinical trials. It is very usual that during these phases of the clinical trial, the common side effects are detected, while there is also a signal or could be a signal of what could be the potential rare side effect that would come. During the implementation of the vaccine in a much wider large scale, these rare side effects are usually identified. That is the thing which you have heard the regional director say. Each countries which are reporting these cases also demonstrate that robust systems which are already in place, which WHO has been telling from day one. So, yeah, thank you so much.
Yeah, thanks, Siddhartha. I've got a follow-up question which is also related to the AstraZeneca vaccine, which I think I should also pose to you now from Adam. Does WHO assess also individual batches or the AstraZeneca vaccine as such?
So yes, within the evaluation of the good manufacturing practices, we look into a couple of things. One is what is the effect or the safety and efficacy of the active ingredient which will make the vaccine. But also, as a part of the good manufacturing practices, we look into these practices from each and every manufacturing nodes. So the answer to your question is we do not look into particularly each and every batches that are being developed by the manufacturing nodes, but that goes into the wider platform of the good manufacturing practice evaluation of the manufacturing nodes that are producing the vaccines. Thank you.
Thanks very much, Siddhartha, and thanks for the question, Adam. Right, I'm going to go to our journalists online, and I'll start with Esmir Milovic from N1 Bosnia-Herzegovina. Esmir, good morning.
Good morning. Dr. Kluge just said in your opening statement that the Balkans region is one of the most hit regions in Europe region among 53 countries. So can you go a bit in a detail when it comes to Bosnia and Herzegovina and Serbia? What is the situation there? Also, are you afraid that the situation with vaccines which are not yet inoculated in Bosnia could make this situation even worse if we still wait weeks and weeks and weeks till we get either vaccine through COVAX or our own government purchased vaccines on the market? Thank you.
Regional Director, please.
Thank you. We are in daily contact with Minister Lončar, the Minister of Health of Serbia, and actually I'm heading to Belgrade very soon, and also with the ministers of health of the different entities in Bosnia-Herzegovina. In fact, recently we had a video conference, Dr. Tedros, the WHO Director General, myself with the President Dodik and the two co-chairs of the presidency to see how we could accelerate the arrival of the vaccines. The country itself has done its share, but this is a complicated matter, particularly in the beginning. We should not underestimate that this is a global, very large-scale effort. It's, in fact, a global immunization effort. It's not just routine immunization, but you make a very good point. The acceleration of the vaccination rollout is a priority, but even in countries where this is happening, like in a number of the EU countries, it's still very important to keep the basic public health and social measures. Why? Because the first objective of the vaccination is to protect the people who are most exposed. And these are the frontline workers, the healthcare workers, the social workers. And second, the most vulnerable, which are the elderly people and the people with a decreased immunity. We have constant discussions with the leadership of the European Commission to accelerate also donations to the Western Balkans.
Thank you very much. Now, I'm wondering if I could call upon Dr. Catherine Smallwood to also expand on this in terms of the situation in those member states. Katie, please.
Thank you, Rob, and thanks, Ismail, for the question. Yes, we're particularly worried about the epidemiologic situation in the Balkans, as well as many other countries around Central Europe. And just as the regional director said, early introduction of vaccine, and even with rates that are higher than most of the other countries in the WHO Europe region, Serbia is still seeing a very significant increase in transmission. So early status of vaccination does not necessarily vaccinate you against very poor epidemiologic trends. And that's because we're first vaccinating those people in those higher risk age groups. Those are not the people that are driving transmission. And we also know that people who get sick that are not in those most high risk age groups also end up in hospital. It is not just a disease that only affects those that are over 65. We know that, and we know that people in younger age groups who are healthy also end up in intensive care and for very long periods of time. So hospitalizations will still continue to occur, and we've got a long way to go yet until we really see any ability to measure the impact of the overall vaccination. So for the time being, what is needed, especially in countries where we're seeing the circulation of new variants of concern, and we are seeing this in the Balkans, we need to stay strong, use the public health and social measures that we know work, that have worked in other parts of the region, and we need to really recommit to those and stay on track and bring those cases down. Thank you.
Thank you very much, Katie, and thanks for the question to Esmir. Okay, we will next go to Gunilla van Hol from Svenska Dagbladet. Good morning. Welcome back, Gunilla.
Thank you. Can you hear me?
We can. Please go ahead.
Okay, thanks for taking my question. It is to Dr. Kluge. It is on AstraZeneca. Whatever the decision is today or conclusions from the EMA, how do you think that people's confidence in vaccines, AstraZeneca vaccine, and perhaps in vaccines in general, have been affected by this pause and these questions? Do you think that the vaccine hesitancy has increased? And what effect could this have on the chances of reaching herd immunity sooner rather than later? Thank you.
Thank you and welcome back, Gunilla. It's an extremely important question and matter, but it does not only relate to the COVID-19. In any vaccination campaign, it is crucial to have the trust, the confidence from the population. And basically we do this by transparency, to be transparent. So communication from day one is very, very important to the people. What do we know, what we don't know, and what's going to happen. Number two, empathy with the people. And number three, to be competent. And that's what's happening in several countries. We need to keep the confidence. If it's lost, we need to restore it, particularly for AstraZeneca, which is the big supplier to the COVAX facility, which is the only facility which is really looking at a equitable access. So it's about being transparent, showing empathy, and being competent. Thank you.
Thank you very much. Right, I'm next going to go over to Stefano Valentino. Stefano, welcome back from the European Data Journalism Network. Stefano.
Hello. Hi, good morning. Thank you for the conference and taking my question. So have a question on production capacity. So there is a debate as to whether or not the production should go through voluntary collaboration between vaccine producers and third-party companies, which is the strategy which has been adopted by the European Commission, for example, and it seems to be also endorsed by the last TRIPS Council, or else basically suspended the protection of patents so that third parties could produce vaccines without any restrictions. The European Union, the US, and other Western countries said that there is no issue with production capacity. We can scale up the capacity to a point where we can produce for everyone. I haven't seen any data provided by any organization showing which is the used capacity and the non-used capacity right now. I would like to know if the WHO has the data or it plans to gather this data to quantify exactly to which extent we can stretch capacity to produce the vaccine. Thank you.
Thank you, Stefano. And I'll go to the regional director and then to Siddhartha Datta.
Definitely, Stefano, the voluntary collaboration is extremely important to beef up the production capacity. And we do see some examples, no, that otherwise competing pharmaceutical companies are in fact stepping forward to beef up the manufacturing capacity. Absolutely. Number one. And number two, we need to increase also the portfolio of the vaccines. That's why the Johnson & Johnson vaccine is eagerly awaited. And then we continue to work also with the Russian Federation very closely on the emergency use listing of the Sputnik V. So the points you raise are very, very valid. Thank you.
Siddhartha?
Yeah, thank you so much. And thanks, Stefano, for that question. Just continuing from where the regional director left, we strongly feel that access to vaccine to all countries is a shared responsibility. That responsibility lies with the member states, that responsibility lies with partner agencies, but also with the vaccine manufacturers. As per your question on the scale up and the data on the projection of the vaccine volume, COVAX with the CEPI and Gavi in December gave a projection of the volumes of vaccine that are available or would be available through to the end of 2021. As the regional director mentioned, there are new vaccines which are coming in the portfolio, and they are sharing their projected volumes that would be available within the COVAX. So we do anticipate that these new projection volumes will be made available to the global community so that they understand where does COVAX and also the access to these vaccines within the COVAX platform through to the end of the year. These are early teething times, while these projected volumes are based on the current capacities, but we do understand that these values, these numbers could change as some of them would or may face some of the production glitches in the future. So, but moving forward into the different capacity, understanding the different capacity of these vaccine manufacturers will be extremely critical. So they also communicate early to WHO and also to Gavi and CEPI about their production plans and also the different lineups in this whole process. So more to come. Thank you.
Thanks very much, Siddhartha. So staying on the vaccine topic, I go back to the third question that Adam Blazej has, and it's for the regional director. Adam is from the Czech news agency CTK and asks, when can a WHO decision on the Russian Sputnik V vaccine be expected?
Right, Adam. So as I was mentioning, it's very important indeed that the portfolio of the COVID-19 vaccines, which are WHO emergency use listed, is really expanding. Whether we talk about the Russian Sputnik V or the Chinese vaccines on Sinopharm and Sinovac, all of them are working closely with WHO. You may know that the Russian Federation also submitted data both to WHO and EMA, the European Medicines Agency, in what we call a rolling review. So instead of putting at one point the whole package, as data become available, both from the clinical trials and the manufacturing part, those data are being forwarded. And it's really key that the submission of all the data, the complete package, is being accelerated. because that's obviously only then there can be some anticipation of the date of approval. Thank you.
Thanks very much, and thanks to Adam. We next go to Natalia Raventos, EU correspondent at ACN. Natalia, you're joining us online.
Hello, yes.
Please.
Do you hear me?
We do. Please go ahead.
Okay. I have a question on Spain. I want to ask about, because you mentioned that the infections have decreased, but in fact they have been like not going more down, like they are stuck right now, and authorities there now start to ease restrictions ahead of Easter week. So I wonder do you see here a risk that there will be a fourth wave in Spain if this happens, and if you think that the restrictions should be maintained. And if I may, a second question on the case of Belgium, because there has been an increase of cases in the past weeks, even if they have a pretty strict lockdown since October, which has been like very slightly eased. So I wonder what is going on there and why this is happening, even if they have a strict lockdown. Thank you.
Thank you very much, Natalia. I'll go over to the regional director and then I will go to Katie Smallwood thereafter.
Yes, thank you, Natalia. Just to clarify that the message is that for the third consecutive week, the number of new cases is increasing. So not decreasing, is for the third consecutive week increasing with over 1.2 million new cases reported last week. What this is different than the deaths, where we don't see yet an increase. And on the general point you made, absolutely. So this the virus is still there. So the moment that the pressure on the virus is being lifted, then of course there can be again a further increase in the number of cases, particularly with the fast spread of a number of variants of the virus. And that's why the rollout, the act to accelerate the vaccination is so important, but it's only one tool for the time being in the whole set of instruments that we have. On the country specifics, I will hand over, Rob, to Katie.
Sure. Katie, please.
Yeah, thank you very much. And I fully agree with the comments made by the regional director. And when looking at Spain in particular, we do have to recognize that Spain has made incredible progress in bringing down transmission since the early months of this year, where Spain was seeing at its peak this year around 42,000 new cases every day. And now that's gone down by about 7-fold. So cases have been brought down really effectively in Spain, and I think this should be recognized. So the question you ask is really about how to keep those cases low. And as the regional director said, the virus hasn't changed significantly. If it has, it's just got a little bit better. And we've seen these variants of concern gradually, particularly the B117 variant of concern that was first identified in the United Kingdom, gradually replace other circulating lineages, and these are more transmissible, slightly more challenging to control. So every effort, especially coming up to the Easter holidays and other religious holidays that are coming up, we really need to pay particular attention at the individual level to not undermine those efforts that have been made. And I would certainly agree with your comment that there is, of course, a risk for an uptick in cases, and we see that in several countries in Western Europe as well, where cases are starting to creep up, and we're not seeing very, very dramatic exponential increases, but that could happen in the next few weeks because, as we said several times, vaccination coverage has not reached those population groups that are driving transmission. So we need to rely on those public health measures that we have. We need to acknowledge our own personal responsibilities to be careful, to continue to be careful, despite the presence of people being vaccinated. We can't lower our guard just yet. We need to stick to the advice that our ministries of health and local health authorities are giving us. And it's by pulling together individually that we'll be able to contribute to continuing these low-level cases, which have been seen now in Spain. Belgium is also seeing relatively low incidence compared to the very significant peaks that it had previously in the past few months. So yes, we are still vulnerable to increasing numbers of cases, increased burden on hospitals, and it's still happening even in Western Europe. Hospital rates are still high in many countries. So we need to stay really, really vigilant. Thank you.
Thank you, Katie, and thank you, Natalia, for your question, and also the RD for his response. We will move on to Mariela Škrta from SRI Television in Albania. Mariela, please.
Hello, can everyone hear me?
Yes, we can. Please go ahead.
I have a question regarding the AstraZeneca vaccine. A while ago, during the Trump administration, we experienced a trade war between US and China. Are we experiencing the same thing right now, but this time with a pharmaceutical company about who can dominate the vaccine market? And also, I would like to recall the race for a vaccine. And also, a question regarding the rate, the infection rate in the Balkans. I would like to know, how is the situation in Albania? How do you guys see the situation in Albania with the death rates and also the infection rate? Thank you very much.
Okay, so two questions there. The first regarding the vaccines, the second regarding the epidemiological situation in the Balkans, particularly in Albania. So thanks very much for that question. Those questions, I'm going to go to Siddhartha on the first and Katie on the second, please.
Thank you so much. Thanks, Mariela, for your question. In terms of your first question on pharmaceutical company and race for vaccine, as you have heard the regional director say, this COVID-19 vaccination is an enormous undertaking. At this point of time, the demand for vaccine with the available vaccine portfolios that we have or the number of doses that we have is not commensurate to the demand of the vaccine in terms of giving the benefits of this vaccine to the wider population community. The more vaccines that we have on our horizon is better. And I think as the demand of the vaccine will increase, the provision of the vaccines will also increase, hence the need of having that good collaboration with the pharmaceutical companies, which WHO, Gavi, and CEPI are already doing within the platform of COVAX. COVAX is a platform which allows research and development to move as quickly as possible, including the different other systems that need to be in place so that the countries can get access to. In terms of the race for vaccine, I think it's understood and countries are making effort. We do acknowledge the efforts made by the member states to provide their population with the benefits of this vaccine. But I think it's not a race between countries. All countries, including the partners, are fighting one race or running a race that is a race against the virus. So we have to keep that in mind when we try to put that whole big picture in place. Thank you so much.
Thank you, Siddhartha. And Katie, the question regarding Albania, please.
Yeah, thank you very much for the question. And a very brief assessment of the situation, Mariela, in Albania is it's a little bit of a mixed picture at the moment. Transmission rates remain very high. Positivity rates among people tested remains high. So that means there's still a lot of virus out there and it's circulating. The good news is that over the past couple of weeks, transmission rates have come down, but the numbers of people dying are still at a sort of plateaued level, which means that it's still something that needs to come down. We need to bring those deaths down. We need to bring those cases down. And that has to be done by everyone really adhering to the requirements to prevent physical contact, minimize your presence in closed, crowded settings. Please pay particular attention to that. We're very aware that everyone is fed up with this pandemic. There's a lot of frustration. There's a lot of fatigue. And there's a lot of hope coming from the new vaccine rollout, and that will come to bear, but we just need to be patient.
Thank you, Katie. If I can add here that we're also in constant touch with Minister Manastirliu Ogerta, who has done really an amazing job to kickstart and to get the first shipment of the COVAX facility. This is the most challenging. This is what, remember the question from a neighboring country a couple of minutes ago. So to start and then to accelerate. So the first shipment has arrived, and there has been a lot of work being done, because I was mentioning there is a part which remains with the third party, with the pharmaceutical companies. So even if a country is getting its administrative and financial arrangement in place, if WHO, UNICEF has done everything it can, a lot depends on the third party. So we're very appreciative that the first shipment arrived, to a strong commitment of the Ministry of Health, and we do everything now to accelerate the next shipments.
Thank you both very much, and thank you, Mariella, for the questions. So next I'm going to go to Jeremy Lange from Radio France, RFI. Jeremy.
Hi, can you hear me?
We can. Please go ahead.
Thank you. I would like to come back to what Dr. Klug said. I think you mentioned 21 countries that were easing measures, actually. Just make it clear, do you think that this is a wrong decision from them? And are you welcoming the new lockdowns, basically, just like France is about to do probably in the next few hours for Paris? I mean, is it the time for lockdowns and definitely not easing measures?
Regional Director.
Thank you, Jeremy. So our principle stands that there is not one size fits all. Such decisions have to be based really on, not on political considerations, which has happened in a number of countries and still happening. It has to be based on local epidemiological and public health considerations. And this is something we learned. I was telling it's a year ago, since more or less the region became the epicenter of the pandemic. And at that time, the answer was a national lockdown, a national shutdown. Now we know much more. So if subnationally situation improves, it can be a tiered approach. So it's not all or nothing. But the key issue here is that it's not because a particular country is starting vaccinating that the public health and social measures can be ignored. It's all very, very gradual. And particularly with Easter coming up, this has to be considered very, very carefully, because time and again we see that countries which have been doing quite well, the hard-won gains can be overthrown very, very quick. So this has to be done on a case-by-case and even subnational basis.
Thank you very much, Regional Director. And can I remind journalists joining us online, please do announce your news outlet so I can see where you are calling in from today. I'm next going over to Moussa Assi, who is a correspondent with the UN for the Middle East and Europe. Moussa, please.
Yeah. Oui, bonjour. Merci beaucoup. Thank you for taking my question. I'm Moussa Assi from Al Mayadeen TV, correspondent in Geneva, Switzerland. My question is about COVID passport. Yesterday, the European Union says something about that. Maybe it will be a condition to enter to European territory in few weeks or few months. What is your opinion about this matter, this COVID passport? Thank you.
Thanks, Moussa. Over to the Regional Director.
Merci beaucoup, Moussa, pour la question. So, indeed, there is we encourage very strongly, as with any vaccine, that there is a documentation, whether this is paper-based or preferably digital. And that's why WHO is working on a smart digital certificate. But this is something different than a passport. We do not encourage at this stage that getting a vaccination is determining whether you can travel internationally or not. It should not be a requirement. Why? Because of a number of reasons. First, ethical. there is a global shortage of vaccines. So this would increase the inequities. And if there's one thing that we learned from the COVID-19 pandemic, it is that the vulnerable people got hit disproportionately. Second, a scientific reason, we are not sure yet how long the immunity lasts once a person got a COVID-19 vaccine. And paradoxically, it may seem a paradox, but if you get a vaccine, you're protected, but still you can transmit the infection. And third is also a practical reason. But of course, WHO is working on what we call a international trusted framework. So we have to document whether people got the vaccine, otherwise we don't know what is the coverage and the effectiveness, but not as a criterion. Thank you.
Excellent. Katie, would you like to add any points to what the regional director has said?
Only to add, Rob, that we're looking at the details of the announcement made by the European Commission and the agreement made. And just to note that in the announcements by the European Commission, it was clear that this new so-called green card will not be used as a vaccine passport, i.e. it will not be vaccination or lack of vaccination will not be used to prevent people traveling within the European Union. And in fact, what this new initiative does is simply bring together data around that particular patient, around a number of things, including vaccination, including testing status, and potential information from serology on recovery from COVID-19. So we would encourage very much any activity that's used to facilitate travel. This is really important, but particularly on the use of vaccinations passports, as the regional director said, WHO's position remains unchanged. Thank you.
Thank you very much for the question, Musa, and to our two respondents. I will next go over to John Goranitis from Inside Story Greece. John, welcome back.
Hello, thank you for taking my question. Just have a follow-up question regarding the certificate. According to the European Commission's proposition, it will cover both vaccination and test certificates, but as Dr. Smallwood mentioned, also it's for persons who have recovered. What is your comment on that? Should we rely on antibody testing to prove immunity? Is there enough evidence, scientific evidence, that people who have recovered are protected from reinfection? And finally, how long does immunity last in order to give a certificate? Thank you.
Thank you very much, John. I'll pass the floor back over to Katie, please.
Thank you, John. And I'll answer the second question first, which is we still are learning about the duration of naturally conferred immunity as well as the vaccine conferred immunity. So there's still a lot to be learnt in this space. And that is precisely why our position is that immunity passports are, including vaccination passports, are not the way to go yet. In addition to all of the other arguments that the regional director outlined in his previous answer. So in our understanding, and we'll learn more about the EU initiative as it occurs, this is not an effort to use immunity as a precondition for travel. It's simply an initiative to bring around the information that we have in a standardized manner, in a harmonized manner, so that people have access to the right information when they travel.
Thank you very much, Katie, and thanks for the question, John. Okay, so I can see, Gunilla, I can see you've got your hand raised. I'm assuming that's a new hand and not an old hand. So Gunilla van Hal from Svenska Dagbladet, we'll go back to you, Gunilla.
Yeah, thanks. It's another question about the pausing of AstraZeneca. I'm sorry. What is your concern that the pause of vaccination with AstraZeneca has led to more disease or death in these 15 countries in Europe during this time? Thanks.
Thank you very much. Thank you very much, Gunilla. I'll send that over to Siddhartha, please, for a comment. Please, Siddhartha.
Yeah, thank you so much. Thanks, Gunilla, for asking that question. It's very pertinent at this point of time when the countries are making that temporary suspension. It's as you would agree with me that as you have heard, Dr. Smallwood and Dr. Kluge already mentioned, the virus is there amongst us. The numbers are showing that. This temporary suspension is just a temporary phenomenon. The effect of this temporary phenomenon will not be visible in a day or two. We have to look into this very closely. However, as the countries have made this decision to suspend with a temporary quote unquote, they will have to look into the length of this temporariness. And if it goes quite abroad, days or months should not be, then I'm sure it will show its effect. But let me also remind another thing. The vaccine in its current form has got two important elements to confer. One is to reduce the severity of the disease and also to reduce the deaths. So in terms of the case number, it may not have a big impact whether the vaccine, when the vaccine starts to flow again. As you have heard Dr. Smallwood say earlier, the cases that we are seeing now is not limited to the group which is getting the vaccine. So there are several elements, I'm sure we'll have to look into it, but the countries will need to keep monitoring the caseload and also the hospitalization rates moving forward. But however, this temporary, we do anticipate that a decision will be made by both the European Medicine Agencies and WHO very soon. Thank you.
Thanks very much, Siddhartha, and thank you, Gunilla. Next, I'll go over to George Steer at the Financial Times. George.
Good morning. Can you hear me?
We can. Please go ahead.
Thanks. Can I put this question to Dr. Kluge, please? President of the European Commission, Ursula von der Leyen, said yesterday that the EU is considering halting exports of vaccines to countries that she felt aren't reciprocating. She didn't explicitly mention the UK, but given the disparity in vaccination rates and infection rates, do you think EU export restrictions are justified at this stage?
Thank you, George. Well, George, I'm looking at the pan-European region of 53 member states. And what we encourage, well, the principle is that international solidarity for me is not contradictory to national responsibility. But what we do encourage countries is not to wait to share vaccines across the region until they reach a threshold of 70%. The top priority is that every single of the 53 countries starts and covers immediately all healthcare workers and the vulnerable people. That is the guiding principle. Thank you.
Thanks. I next go over to Kostas Davanis from ERT Hellenic Public Television. Kostas.
Hello, can you hear me? Thanks for taking my question. As Dr. Kluge said, the cases in Europe are increasing. We have a vaccine shortage, and we see that the restraining measures do not work as much as we would like. I would like to ask you if there is a need to redefine the strategy for dealing with the pandemic, and if so, what would you suggest? Thank you very much.
I didn't catch all of that, but I think maybe I send that over to Katie. Katie, can I ask you to respond, please?
Yes, I can do. Thank you very much, Kostas. And yes, we are seeing a little bit of a worrying increase in cases in Greece, and we're seeing particularly around the Athens region, particularly burden being placed on the health system and on hospitals, with increasing numbers of patients being hospitalized. So yes, we are of course aware of this. We're concerned. We see that the gradual replacement of variants by B117, including in Greece, and that particular variant of concern is more transmissible. It is also conferring more severe disease. So that means there will be both more cases, and those more cases will go on to be hospitalized more often. So yes, there are additional challenges. But the big lesson that we've learned from the other countries that have had this this new variant of concern is that the existing measures and the existing tools that we do have at hand, they have worked extremely well. You just need to look at the epidemic curves in countries like Ireland, in Portugal, in Spain, in the United Kingdom. It's not through a change in strategy that they have arrived at really bringing down cases to much lower levels. It's by galvanizing people into the existing strategies and re-establishing this community-wide, wide-ranging engagement into the collective response. And that's the way we need to go, using everything. If you think you're a suspect case, isolate yourself, get tested, remain isolated, contact tracing, surveillance, making sure that people who are confirmed are isolated and do not continue to spread the disease. It's the basic measures that will continue to bring cases down. Thanks.
Thanks, Katie. And regarding Kostas' the element of the question regarding vaccine strategy, Siddhartha Datta, would you like to add any points?
Yeah, thank you, Rob. Yes, thanks, Kostas, for asking that question. You talked about vaccine shortage and vaccine strategy, so I just thought of just linking those two elements. Last year, in the month of October, WHO came out with a guidance document telling who should receive the vaccine at this point of time when the vaccines are at the short volume. So as we move forward into 2021, WHO will reconvene again to understand a couple of things. As vaccine volume increases now, who should then get it? Because the population has now again need to be, the entire remodeling need to be done using the disease epidemiology, the vaccine volume, and then the recommendation would be provided to the member states to consider in terms of increasing the vaccine outreach beyond 20% or beyond 50% as some other countries are embarking on. This is extremely important so that we remain within the context of the values that WHO has already framed as a part of who should get the vaccine and the public health impact of any of these recommendations being made. So these are extremely important considerations. This will definitely be looked into at the national level, while there are this overarching framework of what the vaccination strategy would be coming up very soon, as there will be a green flag around increasing vaccine volume and looking into the disease epidemiology overall. Thank you.
Thank you, Kostas. Thank you, Siddhartha and Katie. Next, over to Jamie Keaton from Associated Press. Jamie.
Hi, can you hear me?
Yep, please go ahead.
My question, and hello, everyone. I would like to drill down a little bit to make sure I understood what Dr. Smallwood said about the early vaccination in Serbia, and just maybe broaden that question, that you don't see results necessarily. What I'm trying to find out is what evidence. You mentioned the Scotland and the Israel studies. Could you just be as specific as you can, or drill down a little bit more on that, about what evidence do you have so far that the vaccines are working?
Thanks very much, Jamie. Katie, and then Siddhartha.
Yes, I was going to say I'll let Siddhartha say some more words. The point I'd like to make, Jamie, is we've seen very specific and really encouraging studies produced, and some of those were noted by the regional director in his opening remarks, particularly coming from Scotland, from England, also from Israel, and from some other countries. Now, I think what's very important to distinguish is effectiveness in specific individuals and groups that have received the vaccine against severe disease, hospitalization, and death. That's what those studies are really looking into at the community setting during rollout. That's very different to seeing a widespread or overall impact on overall deaths and overall transmission. And that will begin to be seen as the uptake of the vaccine increases and increases and increases. At the moment across Europe, vaccine coverage is not at those levels that would allow us to make that judgment yet. And Siddhartha will say a few more words about that. But that's what I was referring to in Serbia. I believe, and Siddhartha will correct me if I'm wrong, around 10% of the Serbian population have received complete series of vaccine. That's great in relative terms compared to many countries across the European region. But will that then show an overall impact on transmission and on hospitalizations? Not yet. So over to you, Siddhartha. Jamie, I hope that that's clarified things a little bit.
Thanks, Katie, and thanks, Jamie, for that question, and good to hear from you again. So, considering what, just taking point what Katie left, I think it's extremely important that we understand a couple of parameters while we talk about vaccine effectiveness, or as we say, real thing happening in field. For the vaccine efficacy, as we talk about, comes out from the clinical trial results. And the vaccine effectiveness is what we see when the vaccines are rolled out in real setting. And that is an effort made by WHO along with the European CDC to provide that framework for countries to start looking for it. In terms of the studies that you mentioned and Regional Director also mentioned in his statement, what we are seeing in these countries, as the vaccine was rolled out, we looked into a couple of elements. What has been the protection level in different age groups? Principally, these countries looked into more than 70 years of age group with a much cutoff division around 80 years, what has been the effect. What has come out from these studies, both for Pfizer as well as AstraZeneca, that the results which we have seen from the clinical trials, the protection level or the efficacy, it has shown that these populations get an immunity of around 70 to 80%, ranging from 70 to around 70 after first dose, but with a more than 89% after 2 weeks of the second dose for the Pfizer vaccine. These are extremely important elements because that will ensure that these results which are coming out from these three countries, as you have heard, is almost mirroring what we have seen in the clinical efficacy. These countries could do it because the vaccination coverage has reached quite a significant level before a vaccine can show its effect, these effects which we are seeing in the real-time setting. But as Dr. Smallwood mentioned, each and every country may not see this effect right away because the vaccine uptake is just being scaled up from the healthcare workers to the elderly population. But within the elderly population as well, several countries, more than 65 years of age, which is WHO's recommendation, and the countries are also looking into it. The uptake in different age strata is still happening. They are reaching out to the most vulnerable first, which is the highest age group, and then the other countries are scaling it up for the other age groups below the 80s and 70s and 60s. So these all will have an effect, and I'm sure as you have heard Regional Director say, this is coming. These results will be visible to all of us, and then the trust of the population will further be enhanced with these vaccine effectiveness studies and trials coming up. So these results which I have presented, and also you have heard Dr. Smallwood and the Regional Director say, are already available in the peer-reviewed publication. So we'll have to see how does this real setting results come out in the other countries as well as vaccine uptake improves. Thank you.
Thanks very much. And a great message of hope and promise on which I can close this press briefing today. A very warm thanks to all of you that have joined, both the press cadre, but also the general population that have followed us. My thanks to Regional Director Dr. Hans Kluge, to Dr. Smallwood, to Dr. Datta for joining us. As you're aware, we are sharing Dr. Kluge's statement with you, as well as posting it and a recording on our website online very soon. If you need any additional follow-up, please do reach out to us by email. We'd be very happy to respond. But otherwise, as always, stay healthy, take care, and have a great day wherever you are in the world. Goodbye.